Hey, this is Zach Hutchinson here with Continuing Hope, and this is Breaking the Stigma. I want to thank the sponsors today who are bringing the show to you. Vapors for You, located at 2402 Williamson County Parkway, Suite A1. You can reach them at 618-751-5284. They also have stores in Paducah, Harrisburg, and Mount Vernon. Today's show is also brought to you by Fowler Heating and Cooling at 423 South Court Street, Marion, Illinois, 618-997-5288. Give them a call if you're having any trouble with your heating or cooling. All right, let's get right to it today, guys. I want to introduce you to someone who has been a big part of my life over the past probably about 2.5 years, I would say. Morgan Gant, she's from Integrated Health. If you would just introduce yourself and tell us your title and how long you've been doing it.
All right. Well, I'm Morgan Gant, as Zach said, and 2.5 years sounds just about right because I've been at Integrated almost 3 years. So,
Nice.
um, I am a psychiatric mental health nurse practitioner. I've been in practice in Southern Illinois for it'll be 11 years, actually, the 1st of August.
Oh, wow.
Yeah,
Wow.
which definitely starting to make me feel old. I had one of my first patients I saw when she was 8 years old, just graduated high school this year.
Oh
So
my gosh.
yeah, in my
That's
mind, she's still like a 45-pound second grader who was
Oh,
eating crayons.
oh well, yeah, yeah. Because in our mind, as we're getting older, it's always like that. I always see people as the way they were 20 years ago. I
And
still think it's 1999, Morgan.
yeah,
Okay, so you have been in practice for 11 and a half years, you said?
well, right at 11. It'll be
Right,
11 in August.
right
So,
at 11 years in August. Okay, so tell me this. Whenever I very first met you, we were talking about different places you had worked, and so you've got a wide variety as far as your background goes. Tell us,
yes.
what did you do right after school? Like, what was your first couple places you worked?
So, I went to University of Louisville. I worked in Louisville, actually in inner city, with mental community mental health. Basically, it was
Hmm.
uninsured and homeless, a lot of homeless patients. Um, After that, I actually moved here to Southern Illinois. That would have been in the summer of 2010. I
Okay.
started at Southern Illinois Psychiatry. I practiced there for about right at 8.5 years.
Okay.
Um, and then started at Integrated shortly after I left that practice.
Okay. Now you have done some work also in the hospitals, correct?
Yes, absolutely. So, um, for the 8 years, or I worked at Southern Illinois Psychiatry, I actually did rounds at Harrisburg Hospital at the Mulberry Center.
Ah.
Um, Also have done some consultation work at Gateway in Carbondale,
Okay.
and used to run a behavioral health clinic as a contractor in Vienna, Illinois,
Oh, okay.
with Rural Health Incorporated.
Oh, I didn't know that either. I knew you
Yeah,
had done. I knew you had done a lot of things because you and um, I would say unfortunately, but I do love talking to you. But unfortunately, I've had a lot of doctor's appointments with you, so I've learned a lot of things that just with us talking, where you've been. And Morgan, I think it's awesome that you've got such a diverse background because I've heard of um, anywhere from police officers to military to kids. I've heard them all coming to see you, and I've literally heard good results from everybody, and that is why wanted to have you on the show today, and that's why I refer Integrated Health as much as I can. Um, so I want to get into a little bit about what the charity does. Of course, our charity is Continuing Hope, and it is meant to financially assist veterans and first responders who can't afford the state of the art PTSD and depression treatments at the Albany Clinic.
right.
Can you tell me um, basically what is the definition of PTSD? Is it something that just military guys get? Is it something that anybody can get? Fill us in on that a little bit.
I think that is a very um, huge misconception in the world of or in our society, because a lot of people think, well, I can't have PTSD. I was never in the military. I can't have PTSD. I've never fought in the war. I've never, been the
Yes.
first at a scene of an accident.
Yes.
And even some people had never even considered that first responders or police officers or, anyone in that type of work could have PTSD. PTSD is basically a caused by anything that in the moment for that person was traumatic.
Okay.
So, that could be something your second grade teacher embarrasses you in front of the entire class.
Right.
That can stick with people.
Yeah.
Bullying is a form, causes post-traumatic stress.
Mm-hmm.
Imagine years of your, school career. You're harassed by other children. You're,
Yeah.
publicly embarrassed, things like that, for things that,
Right.
anything that is basically causes a person to feel they are at a loss of control and have extreme anxiety in the moment
Okay. That
can lead to
totally.
PTSD.
Yeah, that totally makes sense. And whenever I first came to see you, it was for really, really bad depression. I was really, really depressed, and I had been diagnosed years before with bipolar also, and I had no idea that I would ever have signs of PTSD until I took the test over at the Albany Clinic, and I scored off the charts. And I remember asking him, I said, "How in the world do I have PTSD?" And
Oh, I remember you were actually no, this can't be. No, this is not.
Yeah, because I was like, look, I wasn't in the military. And that's the first thing that everybody says. They're like, I was not in the military. I didn't see any war. I didn't see anything. And I always tell people, I said, I've never really had any trauma in my life. I've had a good life. I've ran businesses, been successful. I mean, I just think that over time, I think I had been so depressed, and I had been so, just my mind was so consumed with all these things. I think I literally kind of gave myself PTSD. Is that possible?
I mean, absolutely. I think over the course of a lifetime, I was actually talking with a patient the other day who had a really, really bad depressive episode back in the winter and had to make some life changes, take some time off work, which was a big part of her life.
Mm-hmm.
And she, thinking about that episode, even now, we're 6 months, past it.
Yeah.
She's feeling really well. She's back to work. Even thinking about it or going to some of the places she went when she was in that deep depression
Yes.
causes extreme anxiety for her.
Really? Okay. So those are what's known in this circuit as triggers.
Yep,
Whenever
absolutely.
whenever you hear somebody talk about a trigger, a lot of people joke around. There's memes on the internet and stuff where they say people are triggered, but in reality, in the mental health realm, there are real triggers. And for me,
Oh my gosh.
yeah,
And sometimes people don't realize what their triggers, that something is triggered for them until they are exposed to it, and then they get this horrible anxiety, and they don't realize how these dots are connecting in their brain,
that's
even on a conscious level.
that is exactly how I am. I can
It
tell
could be
you.
a smell, a sound, a person, a place,
Yep.
anything.
Yep. My wife, Erin, you know Erin, she
Yes.
a lot of times will just look at me and say, "What's wrong?" And I'm like, "I don't know." And then I'll have to think about it. And then I think back, and I'm like, "Oh, I was at the gas station earlier, and this lady said blah 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 to me, and this is what I've been thinking about all day long," which goes directly into whenever I got my first shot, my first stellate. All of that seemed to go away, and that's why I jumped forward to do this charity so that we could help those guys, because I saw how well it did work. Now, let me ask you this. Dr. Garwin has procedures for severe depression. He also has procedures for PTSD. The procedure for depression is called a ketamine IV infusion, and the PTSD shot is called a stellate ganglion block. Morgan, can you tell us the difference between depression and PTSD? Like, if someone is like me, if someone came in and was severely depressed, and are there certain signs they should be looking for to know that they have PTSD? Is there one thing sticks out more than the other?
So most of what I look for, and usually, unless there's a really very specific incident or trauma that a patient reveals to me on their first visit, usually, even if I'm suspecting there may be some PTSD from a lot of micro traumas versus, a very large trauma.
Yes.
I usually honestly don't diagnose it on the first visit unless they say, I was raped last month. I think I have PTSD or something very similar, or I've spent 7 tours in Iraq.
Yeah.
Usually I'll start to notice, or the patient will start to reveal just some signs and symptoms of anxiety.
Mm-hmm.
That, they're more worried. They have trouble falling asleep because their mind won't shut off. They are, they're feeling like they're wanting to isolate. They don't want to go around people because they start feeling very anxious. in crowds or places they normally would have felt comfortable,
Mm-hmm.
Things like that. And anxiety and depression are so intertwined. It's very rare to meet a person that has major depression that doesn't have anxiety about the way the depression impacts their life, and
Sure.
vice versa. When someone has horrible anxiety and they feel completely uncomfortable in certain situations that they have to go to every day, whether it be work or their kid's basketball game or,
Right.
Then they're going to get depressed because they can't do the things that they want to do.
Yeah.
And that's kind of, my role is to tease out, okay, I ask every new patient the first time I see them, I usually say, okay, we've talked about a lot of different things. If I could fix one thing for you today and make one thing better, what's the one thing we want to focus on? And, interestingly, in my head, I'll be sitting here thinking, depression. And the patient's like, sleep. If I could just sleep, maybe I wouldn't feel depressed or anxious.
Yeah.
I haven't slept well in 2 years. And so what their priority may be completely different than mine. That's why I always try to ask that.
Right. Yeah, no, I understand, and when I was having a lot of depression and anxiety, like you said, the two completely intertwine. For the longest time, when people said they had anxiety, I was just kind of like, how do you get anxiety? What do you mean your anxiety? What do you mean you don't like going into Walmart because you don't like seeing people? But that's totally different. Anxiety is like, it's
intrusive thoughts, having,
yes.
I hear this every day. I had a conversation with someone and it was just a normal conversation, maybe with a coworker, patients will say, or with a friend at the gas station.
Mm-hmm.
And then they lay in bed that night and they're replaying it. And they're like, did I say anything that would have been offensive to that person, even though they know they didn't?
Yeah.
And maybe a friend or a family member was present for the conversation.
Yep.
And the person will go to their partner and say, remember when we talked to Joe at the gas station? Did I say anything that would have, and their partner's like, what? No.
Oh my gosh. I cannot wait for Erin to hear this podcast because I do that to her all the time. And you are just speaking my language. I do exactly what you just said. I will literally.
And really, depending on someone's past experiences, their brain can actually connect dots where there really is no connection.
Yeah.
So if someone says something like, oh, you look really nice today. Oh, did I look terrible yesterday? That's what your brain could hear.
Exactly.
Or you've never told me that before. Do I normally look like, I'm a homeless person? Like,
yeah.
I don't know.
Yeah, exactly. It's like, I lost, I just, I've came off the worst 2 years of my entire life. And I lost 60 pounds.
Yes.
And, it was kind of the same type deal there. I really wasn't trying to lose weight, but I just kept losing it, and people kept asking me about it. And, it was like I told Erin all the time. I said, all these people are like, man, you look great. And I'm thinking, well, did I just look like a fat? Yeah, did I just look like a fat pig before, and you just didn't tell me? Like, come on, man, you're supposed to be my friend,
Yeah, instead of taking it as like a compliment, our brains can definitely turn things around.
It does, and like you said, I mean, when you truly have something wrong in your brain, and your brain interprets things differently than what I would consider a normal person. I don't think there's too many really normal people, but
I don't like the word normal. That's a scary word to me.
It is. But I just, whenever you have that stuff going on in your head, it is so real to you. That's what I'm trying to explain about the PTSD thing and stuff, like the intrusive thoughts and laying in bed and just thinking horrible things and stuff it's so real. And that's why I was.
And the hyper startled, like having your sympathetic nervous system always on overdrive is a very exhausting way to live. And it's very unhealthy for, the rest of your body. Basically, whenever we're, think about, like, I'm at the ATM, okay, someone puts a gun to my head in the inner city. Okay, all of those, all of the things that are released when your body's in fight or flight.
Yes.
Someone who has PTSD, they're releasing those stress hormones all the time.
Yeah.
Say you've been in a car accident, it was just a fender bender, but you still have that like adrenaline rush. You're like, oh, the cops come, everything's fine.
Right.
Nobody has to go to the hospital. You drive home and then you're so exhausted.
Yes.
When you come down off of that.
Yep.
But
legs are shaking.
Living with PTSD feel like that. They feel like that every day, and it's a terrible feeling.
Yep.
And that's one thing I think. That's why the stellate ganglion block does give a sense of instant relief, because it turns that down.
Yeah, and that's great, because that leads right into my next question. On the stellate ganglion block, because we're more focused on PTSD with the charity. On the stellate ganglion block, I know Dr. Garwin, specializes in that, but I know you know quite a bit about that too. Um, you were talking about the fight or flight and all that stuff. What does it do? What have you noticed from like vets that you've talked to that have had it? What have they noticed being the number one benefit from it? Because for me, it was those intrusive thoughts and
turning down that
yeah.
connection between your sympathetic nervous system and the amygdala. The
Okay.
big thing that I hear over and over is people say, I felt like a weight was lifted off my chest, or I could take a deep breath again.
Okay.
When people are dealing with anxiety, you get so many changes physiologically to your body that you don't realize how tense your muscles are, how you're carrying tension in your neck, your shoulders, your back. You don't realize that you may take shallow, rapid breaths versus like deep, longer, deeper breaths.
Yeah. Yeah. That makes sense.
So people, definitely say they don't feel like their heart's pounding. They don't feel like that. They feel like they can breathe. Their mind isn't, they may have one thought at a time instead of 75 thoughts at a time running through their head.
Yeah, exactly.
They can make sense of things. They're not overthinking.
So basically you get the
terrible.
Yeah. So basically you get the same feedback as the feedback I gave you, because I had everything you just said. That is what happened to me. Now I am not a vet. I was not in the military. So I didn't have any kind of trauma like that, but the thoughts and things, the intrusive thoughts, the remembering things from 20 years ago and laying in bed wondering what I said that day. Like, even if I leave just a small meeting, I get in my car and I'm like, man, what did I say? I don't remember what I said. Did I say anything to offend anybody? Well,
Right.
As soon as I got that shot, all of that went away. I can leave a meeting and go get in my car and drive home and not think a thing about it. And it's so, just, man, it's great.
It's a liberating, a freeing feeling.
Liberating's exactly.
Trapped in your mind, because when you're analyzing all these thoughts that don't need to be analyzed and having all these intrusive, anxious thoughts, you can't really be present in your life. Like, you cannot watch your kids play because your mind is so, if someone tells you something, you won't remember it because you're so inside your own head. You're literally trapped in there.
Yes.
You appear to be present, but you're not.
And when people are talking, it's like whenever I get home, I have to ask Aaron, I said, what were they saying whenever they were talking about this or whatever? Because at that time, I may have seen somebody across the store that reminded me of a job I had, and then that reminded me of a person I worked with, and I'm just gone. I'm just gone. I just don't have anything. I'm not present, and the shot. That's why it's so important for these veterans to get these shots. And it's one of those things. If you can get the volume turned down in your head, which is basically the way I say that this shot does, this stellate block.
Yep.
I think it turns the volume down. And if you can get the volume turned down from all of those thoughts, even a little bit, I mean, it is.
I think it not only turns it down, I think it's like almost like you're in between radio stations and like you're getting one song, you're getting like half a song and then someone talking and then 20 other things.
Yep.
And it like actually just tunes it into one station so you can focus on one thing at a time.
Yeah, you know what? That's a good analogy because it kind of does that to me too. It allows me to kind of focus on things. I'm one of those guys that I have to work physically all the time to keep my mind busy. And I've noticed since I've got the shots, I even told Aaron that I said, I want to work more on projects and finish them rather than have 15 or 16 projects sitting around not done, So guys, listen, it is an amazing procedure. It's great. I can't say enough about what it's done for me. I want to go right into my next question, Morgan. When would you refer someone to the Albany Clinic if they came in and they were your patient? Like me, I had been with you for 2 years before Albany even opened up, or maybe a year and 8 months or somewhere around there. But when someone comes into you and they're a little bit depressed and they said, well, hey, I talked to Zach Hutchinson and he said that you could get a ketamine IV infusion over at the Albany. I think I want to do that. What are their qualifications to be able to get that and to get the PTSD shot?
I think the biggest thing that if it's a patient that is medication naive, say they maybe tried a medicine once, 10 years ago, I'm not going to jump to ketamine. It's not it still, does it work quickly? Yes, but it does not, the results, you have to repeat the infusion generally to get lasting results.
Yes.
So I think people assume just from like what they've seen on TV or heard, that they can just get one IV ketamine and they're like, woo, I'm done, I'm good, like for the rest of my life.
Yep.
No, that's not how it works.
Yeah, exactly.
You know, I've had patients feel worse. They, at times they have to get 2 or 3 to actually feel a lasting effect or a calming or improvement in mood. It's definitely for people with what we call treatment resistant depression, that either they're on a medication and yes, they're better, but they're still not functioning at the level that they would like to be.
Right.
They've tried multiple medications and maybe had side effects from the majority of them, or just felt, even I've had patients that feel worse on antidepressants. They feel more depressed.
Yes. Mm-hmm. I know how that is too.
Or they just don't tolerate it. Actually, I mean, with Dr. Garwin, he won't infuse a patient unless they are on at least a small to moderate dose of an antidepressant that they're tolerating.
That's what I was kind of getting at, because
he knows, as I know, as a professional, we're not making promises that are unrealistic. You have to put the work in too.
Yeah, and that's it's funny you said that, Morgan. You're exactly like me in that I always say people have to be proactive. Like you can't go around here and say I'm depressed and I want to take my own life and this and that. And when somebody offers you something like this, you can't say, I don't go to doctors, or I don't do that, or
right.
I see this thing on Facebook all the time, and I know it's just a joke, but these people always say that they medicate with Red Bull and Excedrin or something like that.
Yeah.
And I know that's meant to be a joke, but there's literally people out there that think they can go without medicine and they can go without treatments and stuff. And oftentimes those are the ones we see that take their own lives. And it's really unfortunate, because there's help out here at Integrated Health. There's help out here at the Albany Clinic. And I just wanted to make sure that I was right by saying that you had to be treatment resistant
yes, absolutely.
to get a consult at the Albany Clinic. Now, how do you get a PTSD consult at the Albany Clinic? Is that the same type deal, or is that separate?
With PTSD, you don't have to have tried multiple medications. You have to have obviously an distinct trauma and meet criteria, diagnostic criteria for PTSD.
Okay.
But it doesn't have to be. PTSD is still a wild beast when it comes to psychotropic meds. I mean, there's really, even the VA, who's done the majority of the research on PTSD, can't say here's the best way to treat PTSD.
Right.
Because it really depends on each person, the type of trauma. But we don't really coin PTSD as treatment-resistant PTSD, like major depressive disorder.
Right.
Because it's very different. But I think with that, as long as the person has a trauma, and I feel like they're having a lot of anxiety related to it, they're having intrusive thoughts, they're having even flashbacks from the trauma. They're avoiding certain situations that remind them of the trauma. Mm-hmm. Anyone who has those type of characteristics would be a candidate for the stellate ganglion block.
Okay. Now, one more thing I wanted to ask you about is you guys at Integrated Health have a psychotropic gene test, and I'm a big fan of this. This gene test is a cheek swab, and it tells you basically what medicines your body will react with and which ones they won't. Can you just briefly tell us a little bit about that test and the results that you've seen with it?
So GeneSight is the name of the company. Mm-hmm. They're actually a small company based out of Ohio. I've been using GeneSight for about 2 to 3 years now in my clinical practice. Is it I think some people have the misconception that it will tell me exactly what medicine they need and this medicine is guaranteed to work. Mm-hmm. Absolutely mm-hmm. not. What it tells us is which medications your body can break down properly. Okay. What medicines do you have the functioning copies of the genes or pathways to be able to break that medicine down. When you can break a medicine down properly in your liver and metabolize it, then it has a much better chance of working well and not causing adverse effects. That's the big thing that GeneSight allows us to do, is avoid unnecessary side effects.
Okay.
That can really, having a side effect or a bad reaction to a medication can basically get someone who is already hesitant to get treatment. They can just say, absolutely, I'm not taking anything else. I'm done with this.
Oh, absolutely.
So
absolutely.
If we can avoid that, especially if they've already had a few bad reactions.
Yeah.
And I can avoid giving them, a fifth or sixth bad reaction.
Yeah, no doubt.
They're going to feel a lot more confident.
I remember when I took the gene test at Integrated when I first started seeing you, and most of I remember there was a green list, there was a yellow list, and there was a red list. And I remember 2 or 3 of the medicines I had tried were on the red list. And I was thinking to myself, like, thank God I didn't have any bad reactions to those. They
Right.
just end up not working. But,
Yeah,
I
you
can
probably, potentially, medicines can end up in the red because you over metabolize them, meaning you break them down quicker than they have time to work,
Okay.
or because you can't break them down. Generally, the ones you can't break down are the ones that are likely to cause the most side effects because they just build up. Every dose you take just builds up in your body, and you're not properly, metabolizing it, so you're gonna have more side effects.
Yeah, and you don't want that. I have had side effects from medicines.
And it really, when you're already feeling terrible mentally, to add something physical,
Yes.
that is the worst punishment I can do to a patient.
Yes.
And that makes them trust me less. Who's a candidate for GeneSight? I get people who say, I heard about GeneSight. I've never tried medicine before.
Oh.
I want to swab.
Yeah.
I say, can I swab you? Absolutely.
Yeah.
When do I recommend it? When people come to me with a laundry list of things they've tried.
Yes.
In primary care, or with another provider, and they say, well, I tried this for 2 days, I had diarrhea. I tried this one, it gave me sexual side effects. I tried this one, I had migraines. I tried this one, it made me too sleepy, I gained weight.
Yeah.
I say, okay, you need a swab.
Yeah,
we got to see
exactly.
which pathway are you not breaking down.
Exactly.
Why is this happening?
And this all goes back to everything we've talked to. Goes back to being treatment resistant. It's the same way with the like you said, the stellate block is not really for treatment resistant, but it's for that severe PTSD, and the ketamine IV infusion, even for vets and first responders that do have a deep depression, and they have treatment resistant depression. They can go to the Albany Clinic and get their ketamine IV infusion, and Continuing Hope, my charity, is meant to pay for that. So that will help them out as well. The gene test is great. I remember getting my results. Morgan has finally got me on the right medication. Thank you, Morgan. I feel amazing between you and Dr. Garwin. I've said this before, and I'm not trying to make you feel uncomfortable, but you guys saved my life, and I appreciate it.
Hey, that is my goal. Is really why I do what I do is because I really like seeing people function at the level they want to function. I don't want to see people feel normal, because what in the hell is feeling normal? I don't know what that means.
Yeah, I don't either. I don't think I've ever felt that way.
Yeah, it's different for everyone.
Yes.
I think what scares me? People who say, well, I don't have issues, I'm normal. Oh, gosh.
Oh,
okay.
man. Yeah. They got more issues than they know about.
Absolutely.
So,
I always try to get from people, what was your normal before all of this happened, before a trauma, or before you became depressed? How did you function? If you're a person who your whole life has just been kind of meh, I've never been excited about anything, if that's your baseline, then I'm not going to get you like jumping up and down, and
right.
saying like, I feel amazing. That's not going to happen with prescription. It maybe with the illegal drugs, not
yeah. It's everybody thinks that, and that's not the case. It even goes to people, like I remember hearing people before say, "Oh, I got to take my happy pill." Well, there's really no such thing as that. What they're talking about a happy.
If there was, I'd be taking it for sure.
Yeah, I'd have them in my pocket right now, like Tic Tacs. Whenever they're talking about a happy pill, they're more than likely talking about a benzo, which is normally just going to kind of make you tired. So it's kind of there's just no such thing, So I want to ask you one last question. What do people need to do if they're listening right now and they're feeling like they might want to take their life? Is there any particular websites they can go to? Is there anybody they need to go straight to the ER? I mean, what's the criteria there? If they're sitting there listening to this show and they're like, you know what, I've had it. What do they do, Morgan?
Well, obviously, number one would be talk to someone. Mm-hmm. Reach out to anyone that in your circle, or even outside, an acquaintance. I think people think that they'll scare people if they say that. The suicide prevention hotline, you can talk to someone 24 hours a day on the hotline. You can even do chats online with suicide prevention workers.
Oh, really?
People who volunteer or are trained. If you don't want to talk on the phone, you can literally chat online.
Well, because most of the time they're so upset that they don't want to talk anyway. They're crying and everything else. So that's a great thing.
Going to the ER, yes. At times, unfortunately, we don't live in a big city. When I was at University of Louisville, they did a pilot study to have a psychiatric, like part of the University of Louisville Hospital's emergency room was a psychiatric emergency room. It was amazing. Because the patients who went in with suicidality or who were psychotic and needed their medications adjusted, when they went into the psychiatric side of the ER, they weren't taking beds of patients who were having heart attacks or had gunshot wounds or were in motor vehicle accidents. And they were cared for by people who are trained and who enjoy caring for that type of patient.
Yeah, well, that's good.
So,
that's good.
it really helped. Sometimes I feel like, you go to the ER and you're suicidal, they're going to do what they can, but they can't just get you into someone like me overnight.
Right, exactly.
Sometimes locally we have to send someone to, Terre Haute, Indiana, or Evansville, or, if there's no beds available, the only even local option we have is Harrisburg, which is, often full. So people have to wait in the ER for 2 days until they can be sent somewhere. By that point, they're like,
oh man, yeah. By that time, they're either fed up or they're risking going back home and just being right in the exact same position. Yeah,
exactly. So our system is broken. I wish I had a better answer for that, but definitely there is help. You just have to make a connection. That's the biggest part, and you can't be scared of being judged. I think the first thing people tell me, new patients, I was so nervous about this appointment. I'm like, okay. I said, you will never feel that way again about coming in to see me. The first time, once you meet me, like that should not happen.
No, you have got a personality that is perfect for the job you do. Whenever you go in and you're depressed, my first appointment where I saw you guys, I'm not embarrassed to say it. I was in there crying. I was so depressed. And, when you guys came in and I saw the smiles on your face and I saw the information and the knowledge that you had, I thought, I'm in terrible shape right now, but they've got me covered. Integrated and Morgan, they've got me covered. I'm going to be fine. And here I am 2.5 years later. I've went through a lot of med changes. I have done ketamine IV infusions. I've done I've done the PTSD shot a couple times. And with the medicine that you've got me on and the bridge that I used with Dr. Garwin, I am much better. I've got this charity going, trying to help other people, and it has been a wild ride, but it is a ride that I'm glad I took with you and Integrated. And I just want to tell you how much I appreciate you being on the podcast today.
You know that I must really like you because I don't normally do this kind of stuff.
I know.
I never know what's going to come out of my mouth, so sometimes I have to get myself right.
Yep, I am the same way. And I told when I was talking to Dr. Hester the other day, I said, I'm trying to get Morgan on a podcast, and
he probably said, good luck.
He said, well, I'll have to talk to her. I don't know. And I said, you know what? I said, a phone call will be perfect because I'm in this studio anyway and got you on here. And like I said, I just want to thank you for everything you've done for me and my family too, because what you've done for me has affected my whole family. I want to thank Integrated and all the information you gave us today. It's very, very valuable, and I know people listening will get some great value out of it. So thank you, Morgan.
See, we had to get me over my anxiety about doing it, though. So.
That's right. That's right. Well, I helped you today, and I'll be sending you a bill. No.
Hey, I'll send you a copy of my insurance card.
There you go. There you go. Well, hey, Morgan, I'll let you get back to your day, and I appreciate your time. Thank you so much.
All right. Thank you.
All right. We'll see you, Morgan. Bye-bye. That was Morgan Gant, everybody, and she had some great information for us. Appreciate her being on the call today. And before we get out of here, I just want to thank my sponsors one more time. Vapors for You at 2402 Williamson County Parkway, Suite A1. That's in Marion, 618-751-5284. They've also have stores in Paducah, Harrisburg, and Mount Vernon. The show was also sponsored by Fowler Heating and Cooling at 423 South Court Street, Marion, Illinois, 618-997-5288. You guys stay positive, get rid of anybody negative in your life, and try to help somebody. You guys have a great day. Thank you.